Okay, I'm looking at my patient Dolly Parton today. She's a female. She was born at 10/02/1985. She's a full code status. Her comments say that she presented to the ER 2 hours ago. It looks like our primary concern for her is acute urinary retention. Looking at her vitals, everything appears to be fairly normal. Her blood pressure is a bit high, and her respirations and heart rate are normal, but they're on the higher side of normal, so we should continue to monitor. She does have a swelling, redness, and rash reaction to latex, so we'll want to make sure to look out for that. And then we do have an order to insert an indwelling urinary catheter for her, which is active and due now. So I can go ahead and gather my supplies. Over here I have a 12 French Foley catheter kit. All of the supplies in here are not made with latex, so that is good with Dolly's latex allergy. And then I have some supplies for pericare, and then my lube, my sterile lube, and my tape to secure the catheter once it is inserted. So let's go see our patient. Knock, knock.
Come in.
Hi, my name is Ella. I'm going to be your student nurse today. How are you feeling?
Not too well.
You're not feeling good? I'm sorry to hear that. One sec. Let me provide privacy for you really quick.
Thanks.
And can I have you confirm your full name and date of birth for me?
Yeah, my name is Dolly Parton, and my date of birth is 11/02/1985.
Okay, that does match what I have here on your wristband. It also says that you have a allergy to latex, is that correct?
Yes.
Okay, wonderful. Do you have any other allergies, food or med allergies?
No.
Any allergies to the environment?
No.
Maybe betadine, iodine, or adhesives?
No.
Okay, wonderful. Do you mind if I steal this table for me really
No,
quick?
it's okay. Go ahead.
Okay. All right, and I'm just going to raise your bed up a little bit just so I can talk to you a little bit better. So I saw in your chart that you're having issues with some urinary retention. You're not being able to get everything out when you pee. Is that correct?
Yes.
Okay, yeah, I'm sorry to hear that. About how long ago did that start?
Yesterday morning.
Yesterday morning. Okay. Is the last time you peed, the last time you were able to urinate was yesterday morning?
Yes.
Okay. All right. Have you been able, let's see, before that, the last time that you urinated, what were the characteristics of your urine? Was it cloudy? Was it really dark? Was it, did it have any odor, or how much were you able to get out, that kind of thing?
Well, I don't remember the color. It's just like it was, I expect to urine, like an average amount, and it was just a small amount, and it was kind of burning when I was urinated. And about the other, it was like strong.
Kind of a strong smell? Okay. All right. Have you had issues like this in the past?
No, it's the first time.
This is the first time you're experiencing issues like this. Okay, well, we'll definitely want to get that noted from you. Since you haven't been able to urinate since yesterday morning, are you feeling any sort of pain or tenderness in your abdomen, I imagine?
Yes, in the lower part of my abdomen.
Okay, yeah, we'll definitely want to take a look at your abdomen and see what's going on down there. And then we also, I'm just going to ask you a couple of assessment questions as well. Do you have a history of UTIs?
Oh, yes, but last year.
Okay, all right, so a while ago. Okay, have you had any STIs?
No.
Okay, if I could just get a feel for maybe your lifestyle, about how much water would you say you drink a day?
Oof, I think a normal amount. I mean, just like my bottle can retain like 1.5 liters, so maybe just 7 of that one.
Okay, all right, yeah, good amount of water. Keep everything moving. That's
good. For work, I need to move around.
Okay, yeah, that's good. Definitely definitely good to keep moving. Definitely good for your body and stuff like that. About how many? Obviously, this is right now is out of the norm for you. What would you say? How many times would you say you urinate on a normal day?
Oof, that's hard. I think maybe after each meal, so 4 times, 5 times. But again, for work, I'm moving around, so sometimes I don't have a place really to go to the bathroom, so I just need to just hold it.
Yeah. Okay. All right. So sometimes you hold it to do work, but have you ever had issues with retention when you try to go to the bathroom, or is this the first time?
No, yes, this is the first time. Yes.
This is the first time. Okay. Okay. Could you tell me how many sexual partners have you had in the last year?
Well, I've been married for 15 years, so just one.
Okay, just the one. Okay. And do you have what was the date of your last menstrual period?
I think 2 weeks ago. Yes.
About 2 weeks ago, okay. Have you noticed any irregularities in your cycle as of recently?
Well, I'm irregular, so yes, but it's.
Okay.
I think that that's normal.
Nothing super out of the ordinary that's presented
No.
itself. Okay, good to hear. Good to hear. Okay, have you had to get up in the middle of the night to go to the bathroom? Have you felt that urge?
No, no,
No. Okay, that's not part of your normal routine. Okay. Have you ever noticed any blood in your urine?
no,
Okay.
definitely no.
Your vaginal discharge. Have you seen any irregularities in it as of late? How would you describe it?
Well, I think that it's clear and it's like an average amount. I think so. It's just normal.
Okay, all right. You said, and would you say it's more clear, or would you say it's more cloudy, or maybe yellow, anything like that?
No, no, it's clear.
Okay, and no abnormal vaginal secretions, no abnormal, no pus or anything like that?
No.
Okay, wonderful. Okay. Well, we definitely want to ask that just so we make sure to get a baseline for you. So the reason why I came in here is because we have an order to insert an indwelling urinary catheter. Have you ever had one of those?
No.
Okay, so what an indwelling urinary catheter is it's a small tube that we insert into your urethra and we advance it all the way up to the bladder. Once it's in the bladder, we blow up a small balloon that holds it in place, and then from then on, it drains any urine in your bladder directly from the bladder through the urethra, through that small tube, to a collection bag that we hang at the foot of your bed in an immovable spot. So that those issues with retention that you're having, since you haven't been able to urinate since yesterday morning, you shouldn't have those issues anymore because it doesn't rely on anything else other than that tube, and it just carries it right out. Okay, so hopefully that will relieve some of the maybe some of the pressure, some of the pain that you're feeling in your stomach.
Okay.
That pain in your stomach, if you were to rate it on a scale of 0 to 10, 0 being absolutely no pain and 10 being the worst pain you've ever felt, how would you describe it?
Well, right now it's like at 6.
Maybe a 6. Okay, so definitely not very enjoyable, something that's been very persistent. Okay, that type of pain that you're experiencing, would you say that it's stabbing, aching? Is it radiating anywhere?
I don't know. It's just like I feel that I'm full and it's uncomfortable to, in my abdomen. It's just like I think that it's completely full and just that. It's just the feeling that I need to get rid of something and it's still there.
It's just achy and uncomfortable.
Yes.
Yes. Okay. Has there been anything that you've been able to do to relieve the pain, or I imagine with that full bladder, it's really persistent. Nothing you can really do for it.
Well, until now, no, nothing relieved the pain. But I suppose that what you told me, the catheter is going to work, right?
Yes. Hopefully that will relieve your pain. Yes. Okay. And then also, are you taking any medications, any antibiotics, any diuretics, any medications like that?
No.
No? Okay. All right. Well, I'm going to go ahead and start preparing you to receive the catheter. So I'm going to do a physical assessment. Now that we've kind of established a baseline as far as your routines, I'm going to look at your abdomen as well as your genital region. So is it okay if I'm going to go ahead and glove up. Is it okay if I expose your abdomen?
Yeah, sure, go ahead.
Wonderful. I'm going to perform hand hygiene over here. And then these gloves that I put on are latex free for you.
Oh, okay, thank you.
I'll make sure all my gloves are latex free.
Yeah, I have a bad reaction to that thing.
Yeah, we definitely don't want to use latex when we're inserting that catheter. That's not going to be very enjoyable for sure. Okay, I'm going to go ahead and move this down. Okay. I'm going to move up your gown as well to expose your abdomen. Okay. All right, I'm looking at your abdomen. There does appear to be a bit of distension. I'm not seeing any sort of bruising or any swelling in any areas that would indicate that she has some other issue in her abdomen that would be attributing to the pain. I'm gonna go ahead and palpate your abdomen. You just let me know if you feel any sort of pain or discomfort, okay?
Okay.
All right, I'm gonna try to be gentle, but I'm gonna start right down here in the right lower quadrant.
Yeah. No.
Definitely there, more in the lower quadrant there?
Yes.
Okay. Has that pain been radiating anywhere, such as like your sides or maybe your lower back?
No, in my back. Yes, my lower back. Yes.
You haven't had some onset lower back pain? Okay, definitely something that we'll want to note as well. Okay, I'm gonna go ahead and move this down to expose your genital area. Is that okay?
Yeah, sure.
Okay, and I'm gonna go ahead and get you ready for the procedure. So I'm gonna take this blanket all the way down, and then I'm gonna position you so that way you're in a good position for the procedure once we get to that point. So I'm gonna go ahead and have you bend your knees. You can remain laying down like that, but I'll have you bend your knees, but keep your legs, keep your feet apart, about 2 feet apart here.
Okay.
Okay, and that just allows me to look at your genital region just a little bit better. I'm just going to note the outside appearance. I'm not seeing any sort of redness, swelling, rashes, lesions, bleeding, or bruising to the area. Do you mind if I separate your labia?
No, yeah, go ahead.
Okay, I'm just going to be looking for any external signs of infection, any abnormal discharge, any issues with the skin, and it appears that you are looking at everything looks fine down here, no signs for concern. So you are, like I said before, you're going to be a great candidate for this this urinary catheter. Okay. So now that I've performed this physical assessment, like I said, I'm going to have you remain in this position. I have already provided privacy, and I'm going to try to keep you uncovered for as little time as possible. But we do need to have you stay uncovered from this point forward, okay?
Okay.
All right, I'm gonna go ahead and I'm going to perform perineal care on you. So I'm gonna make sure that your front side and your back side are clean before we start this procedure. I'm going to prepare my supplies. After I prepare my supplies, I will go ahead and lubricate the tip of that catheter, and it will be inserted. This is not a very comfortable procedure, so you'll have to let us know if you're feeling any sort of pain or discomfort. But it's definitely not going to be the most comfortable thing. But if you're feeling that pain, just let us know so we can stop the procedure and figure out what's going on. And then afterward, we'll tape that to your side of your leg, and then the bag will be hung at the foot of the bed. Okay?
Okay.
Wonderful. I'm gonna go ahead and remove my gloves here. I'm gonna put on some fresh gloves here in a minute. I'm going to raise this up to a more appropriate height here. Alright, once again, these gloves are latex free. Okay, and I'm going to go ahead and use my wet soapy washcloth to go ahead and clean your perineal area here. Okay, and I'm just going to give you some education while I am cleaning your peri area here. With this catheter, we want to make sure that since it's going to be hooked up in your bladder, and we have, like I mentioned before, we have that balloon that we inflate to keep it in place. We ask that you don't mess with it or attempt to rip it out, because that could cause you quite a bit of pain, and it could also cause some damage to you. So we just want to make sure that that does not happen. And then we also are going to advise you to not get up out of bed unless you hit your collate, and then we'll have a nurse come and assist you. The reason why is, again, we just want to make sure that we're not having any issues with that catheter being tugged on or being pulled at, and which would disrupt the position or cause you any sort of pain.
Okay.
Over here I have, now I'm going to rinse with my wet washcloth here. And then additionally, with this catheter insertion, we want to make sure that the catheter is being kept at the below your bladder on an immovable part of your bed. The reason why is because first of all, we don't want the catheter bag to move. We want to make sure it's in a spot, so that way we're able to control it, keep an eye on it. And then additionally, the reason why we want to make sure it's lower than your bladder is because we want to let gravity do its job. So when the urine is being carried from your bladder to your to the urinary collection bag. We want to make sure that gravity is working with it and not against it, and so we want to prevent that backflow, which would cause some further infection. So make sure if ever you move, make sure your urinary collection bag remains above your bladder, okay?
Okay.
I'm gonna go ahead and patch it dry here. And then I'm going to repeat the same process with your backside. And we are finished with peri-care. Okay. All right, I'm gonna go ahead and prep my sterile field here. So I'm gonna go ahead and perform some hand hygiene before I touch my Foley catheter. All right, I'm just going to look at the information here. This is a 12 French Foley catheter kit with all of the supplies. All of the supplies in here are latex free, so they are not a risk to Dolly here. The packaging, it is intact. It has not been opened or tampered with, and this is in date. So we should be able to use this catheter on our patient today. I'm gonna go ahead and open it up. We can dispose of that. Okay. Okay, I'm just going to open this up, making sure I am folding it away from me. Okay. I can touch that last inch of border there. I'm gonna go ahead and grab these gloves from on top here. And then also I'm making sure not to touch anything else. I'm gonna grab our disposable chucks, which will be placed underneath the patient. Okay, and now I will go ahead and perform hand hygiene before applying my sterile gloves. Okay. Looking at these packaging, these gloves are latex free. They are within date, and there is not any damage to the outside packaging, and they have not been compromised. So I'm gonna go ahead and open them up. Okay, looks like my gloves are good, so I'm gonna go ahead and get that out of the way. Okay, and here I have my sterile field, so I'm gonna take extra care not to reach over my sterile field. I'm just gonna grab these alcohol swabs right off the top here. I'm gonna take anything that I don't need out of the box. Make sure that this remains within the sterile field of the box. Okay, I'm also going to make sure that my syringe is going to be hooked up. Go. Okay. Also going to grab my sterile lube here. Okay. All right, and I have my alcohol swabs here, which are going to place right here. All right, and I can go ahead and transfer my sterile field over to the patient. Okay. All right, I'm gonna go ahead and separate the meatus using my non-dominant hand. All right, and I'm going to use my alcohol swab to clean top to bottom, making extra careful that I do not disrupt my sterile field. Okay, I'm going to now take the tip of my catheter and we are going to lube about 2 inches. I'm going to grasp it about 2 to 3 inches away from the tip as I prepare for insertion. Okay, and just to remind you, Dolly, if you feel any sort of discomfort, you let me know, okay?
Okay.
Okay, I'm gonna go ahead and insert this. Okay, and I do observe a flash of urine, so I'm just going to advance 2 inches further. Okay, wonderful. Now, before I plunge the syringe in, I'm just going to anchor it here with my dominant hand and then take over with my non-dominant hand, making sure not to touch my sterile hand. We'll inflate this balloon. Still feeling okay, Dolly?
Yes. I just feel weird.
Yeah, I bet. Okay. I'm just going to withdraw this. Okay. And I am feeling that resistance, so we are in the right spot. We are all set. So I'm going to remove my sterile gloves here. And discard those. I'm going to perform hand hygiene. Okay. Okay, I'm gonna go ahead and put some adhesive on that on the catheter. Make sure it's fully attached to the client's leg. All right, I'm gonna go ahead and attach this. Okay, I'm gonna go ahead and clean up all my supplies here, as well as attach this to the side of the bed. Get that out of the way. Let's see, I'm gonna attach this to an unmovable part of the bed that is lower than the bladder. Okay, and I will go ahead and clean up the rest of my supplies here. I'm gonna keep those chucks on just while we do pericare here in a minute. We'll make sure to clean up everywhere. Put the cap back on my lube. It's no longer sterile. Oopsie. Okay, I'm gonna go ahead and perform pericare really quick once again. Take my wet soapy washcloth and we're going to clean around your catheter here. Okay, being sure not to tug on that catheter. I'm going to take my regular washcloth to rinse once again. And pat dry. Okay, I'm gonna go ahead and remove these chucks for you. Dispose of everything. Okay, all right, Dolly, I'm gonna go ahead and move you back to a good position. Move your gown down. I want you to remember not to be, I want you to be extra mindful of that catheter, okay?
Okay.
Okay.
Thank you.
Yeah, not a problem. I'm gonna go ahead and move your bed back down to the lowest position. It looks like you got your call light right there.
Thank you.
Okay. Looks like you're in the lowest position. There is your call light. And if you need anything, if you need to get up, you just hit that call light and let us know, okay?
Okay.
All right, you have a good day.
You too. Bye.